Public health can't go into a community and use a cookie-cutter approach. We have to go to every single community, understand their needs, their barriers, talk to the people, have those voices be heard, and then build our programs in that way.
Now the community becomes partners in developing the research questions and helping to inform what interventions will be most effective in that particular community setting. Healthy Pontiac We Can is a coalition that brings together partnering organizations throughout the Pontiac community to help envision a vibrant community where everybody can achieve a healthy lifestyle.
Each group bringing something unique to the table, but yet at the same time realizing that we could get more accomplished if we work together.
We primarily focus in on nutrition and physical activity initiatives, and through our strategic planning process we look at what the needs of the community are, and we try to match that with the assets and the resources that our partners have to figure out what types of programs will be effective in this community.
Yeah, Healthy Pontiac. I think the biggest impact that I've seen has been the awareness of food.
Through the Racial and Ethnic Approaches to Community Health grant that Oakland University received through Centers for Disease Control and Prevention, it's provided us with opportunity to help implement certain pieces of our strategic plan. We're collaborating with Sprout and Micah 6 on instituting pop-up produce markets throughout the community at places that have been identified as food deserts that serve the at-risk portion of the population.
How much are they, babe?
6 for $1.
What? Let me have 6.
One of our goals with the pop-up produce markets is to get people in the community where they already are going, so they don't have to make a special trip to a grocery store or drive to another community that is perceived to have higher quality fruits and vegetables at a fancier market. We want people to know that they can have access to these things right within their community at a local trusted community partner.
It's nice to see people choosing the banana over the potato chips and choosing to take that extra couple of minutes to roast some Brussels sprouts as opposed to putting French fries in the oven.
I took beets last week, the week before last, cut them up, boiled them, vinegar, sugar, cinnamon, and then I put them on salad.
It's really nice to see people appreciate it too. Come in here and tell me like, oh, I tried that kale and I threw it in my pasta and my kids didn't even notice, and so thank you for that tip or whatever. And so it's been really nice to hear people's feedback.
One of the projects that we completed through the REACH grant was development of a complete streets plan for the city of Pontiac. This is a plan that helps to prioritize and promote walkability, bikeability, and access to public transit as opposed to motor vehicle-oriented design, which is what we often see in Metro Detroit.
If one can walk and if one can bike to a lot of their activities, leave that car at home where you're not in that chrome, plastic, glass cocoon, man, what it does for your whole just life.
One example of that work that we're seeing come to life right now is on Saginaw Street. In the Complete Streets plan, it was targeted as a street that should have bike lanes installed on it. And so now, as that project is coming to life, we are seeing the first bike lanes being installed in the city of Pontiac as we speak today.
There is starting to be a buzz about cycling and the benefits and just getting out.
One of the goals of the Healthy Pontiac Coalition is to really make the Pontiac community an enjoyable place to live, work, and play. So another focus of our work is also to improve the parks as an environmental piece.
Our partnership with Healthy Pontiac has just been a game changer. Just as an example, they have a grant and we're going to install fitness equipment into Bodette Park, and now we'll have more amenities, places that not only can kids go and play, but their parents can work out and exercise.
We sit in meetings and we make plans, and build programs, but when you get out in the community and you see people biking, you see the opportunities you're giving them with healthy eating and how you're changing their lives. And it just shows so much of an impact of how collaboration and those true efforts of public health can really make a difference in these communities.
I think the city of Pontiac is in the midst of a revitalization, and I think it is so great that Healthy Pontiac We Can has been a part of that transformation for the last 6 years.